Melanoma is a type of skin cancer that originates in the pigment-producing cells of the skin called melanocytes. These cells produce melanin, the pigment responsible for the color of your skin, hair, and eyes. Melanoma is considered a dangerous form of skin cancer because it tends to be more aggressive and can spread to other parts of the body if not detected and treated early. Removal with a margin of normal skin and tissue is the treatment for the primary skin melanoma. Because of possible spread to the lymph nodes, the surgeon has recommended sampling of lymph nodes for melanoma cells spread through a technique called a sentinel lymph node biopsy. A wide local excision of a melanoma is an operation to remove a melanoma skin cancer. Depending on the thickness of the melanoma, your doctor will remove a specific margin of normal tissue around it. In order to close the hole in a flat line, the shape of the excision is usually an ellipse. If there is too much tension on the wound edges, the doctor will need to release the skin on either side from the underlying tissue. The skin edges of the wound are then stitched together, which is called a primary closure. Sometimes the doctor will recommend that a lymph node be removed during surgery to check it for melanoma cell spread. This is called a sentinel lymph node biopsy. The sentinel lymph node is the first lymph node that drains from the area of the skin that contains the skin cancer. The location of the sentinel lymph node is determined by injecting a radioactive dye into the skin cancer and taking pictures in the radiology department that show what lymph node the dye drains into. Then, during the surgery, the surgeon also injects a blue dye in the skin around the skin cancer to visually see the lymph node. During the surgery, the surgeon uses a handheld probe that detects the radioactive signal. This signal and the blue color of the node guides them to the correct lymph nodes to be removed. A small incision is made in the skin over the lymph node, and the sentinel lymph nodes are carefully removed from the surrounding tissue. Any lymph nodes containing the dye should be removed, and the actual number of lymph nodes can vary from 1 to several. If the doctor is worried about fluid building up in the space, a small drain tube may be left in the area. The small incision will be sutured shut. During surgery, there is always a risk of bleeding from the surgical site. Surgeons take precautions to minimize bleeding by using specialized techniques such as electrical cautery, vessel sealing tools, or clips. It is very rare to lose enough blood during surgery to be dangerous or to require a blood transfusion. Nerve injury is when a nerve is damaged. This can impact how the nerve works, causing numbness or weakness of the affected area. Often these symptoms resolve with time, but in some cases the impacts can be permanent. Although rare, some individuals may be allergic to the blue dye injected as part of the sentinel lymph node procedure. Signs of an allergic reaction can include hives, itching, rash, swelling of the face, lips, tongue, or throat, and difficulty breathing. Anaphylaxis, a severe and potentially life-threatening allergic reaction, is exceptionally rare. Checking a sentinel lymph node for cancer spread is dependent on a radioactive dye injection that is given, prior to surgery, that determines the location of the sentinel lymph node. After the radioactive dye is injected into the skin, a special machine is used to take pictures to determine where the lymph node should be removed from. Occasionally, the dye injected into the skin does not mark a specific lymph node. In these situations, the surgeon decides if the sentinel lymph node surgery can be done or if it will not be possible to do this portion of the surgery. Pain or discomfort is common after surgery. Postoperative pain usually improves after 3 to 4 days. Chronic pain that lasts for more than 6 months is far less common. Chronic pain can be caused by several factors, including nerve damage, scar tissue, and inflammation. A postoperative hematoma is a collection of blood that forms under the skin after a surgery. Symptoms of a postoperative hematoma may include swelling, pain, redness, warmth, and a feeling of fullness or pressure in the affected area. Blood may ooze from the incision. Treatment may involve observation, compression, or drainage. A postoperative wound infection is an infection that occurs in the area of a surgery. Wound infections can cause a range of symptoms, including redness, swelling, warmth, pain, and discharge or pus from the surgical site. A significant fever is considered a temperature over 101 degrees Fahrenheit. In some cases, additional treatment may be needed, such as antibiotics, draining an abscess, or removing infected tissue. Wounds can sometimes reopen after they start to heal. This is called wound dehiscence. This is more common if there has been a wound infection or a blood collection called a hematoma. If a wound opens, it will take longer to heal and will often require wound care at home. Risk factors for healing problems include obesity, diabetes, and smoking. Skin necrosis is a rare complication that can occur after procedures that elevate the skin off the underlying tissue. Skin necrosis is caused by damage to blood vessels that supply blood to the skin. This can occur due to surgical trauma, excessive tension on the skin, or complications such as infection or hematoma. Symptoms of skin necrosis may include a change in skin color to dark purple or black and the appearance of blisters. In some cases, surgery may be required to remove dead tissue, which will lead to a slower healing process. A seroma is a collection of clear or slightly cloudy fluid that can accumulate under the skin after a surgical procedure. Seromas develop as the body's natural response to fill the empty space left by surgery. Often, the doctor will let the body naturally absorb the fluid over several weeks or even months. If the seroma is too large or becomes infected, the patient may need a drainage with a needle. If the seroma occurs after needle drainage, the doctor may place a small drain tube that will be left in for several days or longer. Anytime the skin has an incision through it, small nerves that carry sensation from the skin are cut. This can lead to areas of skin numbness near the surgical incision. This is common and usually gets better over the span of several months. A scar is fibrous tissue that forms at the site of surgery as part of the body's natural healing process. Scar tissue can be raised and red, which is more common the first few years after surgery. After several years, most scars appear more flat, smooth, and sometimes widen over time. Scar tissue can cause discomfort, itching, or limited mobility. In some cases, excessive scar tissue formation can result in a condition called hypertrophic scar or keloid. Hypertrophic scars are raised, red, and itchy. Keloid scars are thick, raised, and extend beyond the boundaries of the original wound. Blue dye is injected into the skin around a melanoma as part of the sentinel lymph node procedure. The skin can have a blue discoloration for several days after the surgery but will go away on its own. The urine can have a green color also for 1 or 2 days after the surgery. Pulling and tightness of the upper arm and armpit can be common during the first few months after armpit lymph node surgery. If this condition persists, it could be a syndrome called cording. Symptoms of armpit cording may include a feeling of tightness or pulling in the arm or hand, limited range of motion, and pain when raising or extending the arm. After a skin lesion is removed, it is sent to a pathology doctor who examines it under a microscope. If the skin contains a cancer, it is important that the edges are free of cancer cells. If cancer cells extend to an edge of the excision, this is called a positive margin. You may need to have more skin or other tissue removed if you have a positive margin to ensure no cancer cells were left behind. Some skin cancer surgeries involve removing lymph nodes. Removal of lymph nodes in the armpit or groin area can disrupt the flow of lymph fluid and cause it to accumulate in the arm or leg on the affected side. This is called lymphedema. Symptoms of lymphedema may include swelling of the arm or leg, which can lead to feelings of tightness or fullness and thickening or redness of the skin. Treatment of lymphedema typically involves a combination of compression garments, exercise, and massage that helps to stimulate lymph flow. After surgery, it is important to maintain good skin hygiene and to report any signs of infection or swelling to your doctor. After skin cancer surgery, further treatment may be needed. Additional surgery may be needed if there is concern that cancer cells have been left behind in the area. Sometimes radiation is given using a large machine that gives invisible radiation beams through the tissue. Chemotherapy or immune therapy drugs are sometimes given to help treat the cancer cells. Cancer can recur around the previous skin surgery or in the lymph nodes. This is called locoregional recurrence. Your doctor will examine the area of the surgery to look for this. Cancer can also regrow in other parts of the body. This is called distant recurrence or metastatic disease. Your doctor will tell you if special X-ray scans will be needed to look for this.